Good morning to you and the audience that tune in every morning who is interested to know about developments related to the COVID-19 pandemic. In Cuba, we have at present the same number of visitors, 11,071, 6,667 Cubans residing abroad, and 4,384 foreigners. There are no changes in the number of foreigners in rental houses, 950. The largest numbers are in Santiago de Cuba, Centro Habana, Plaza, and Playa municipality. As of 12 o'clock last night, there were 2,341 people admitted in our hospitals. In surveillance, 61, suspects 1,659, and confirmed 631. In primary health care, a total of 5,992 people. To detect the presence of SARS-CoV-2 virus, 1,937 samples were studied yesterday. 877 at the Pedro Curie Institute of Tropical Medicine, IPK, at the Molecular Biology Laboratory in Santiago de Cuba province, 375. In Villa Clara, 325. In Havana, 158. In the Civil Defense Laboratory, 110, and 92 at the Center of Engineering and Biotechnology Laboratory. As a result of the analysis of the 1,937 samples, 18 people tested positive. With yesterday's tests, we have a cumulative total of 59,648 samples studied and 1,703 positive cases. That is 2.9% of the samples processed in our country. Of the 18 cases confirmed yesterday, all of them were Cuban. 12 of them, or 60.6%, were contacts of confirmed cases. Bringing to 1,455 the number of confirmed cases in Cuba. That is 87.5% are people who have been related to a person who was already confirmed as a positive to COVID-19. Yesterday, in 3 cases, the source of infection could not be identified. And to date, the country accumulates 78 cases whose source of infection remains unknown, for 4.6%. Of the newly confirmed cases, 3 have sources of infection abroad. Of the 1,703 cases confirmed in Cuba, 129 have a source of infection abroad, which is 7.7%. Yesterday, I was asked how they could have a source of infection abroad if foreigners are not entering our country. Well, although we have not offered details, flights have been arriving from abroad with Cubans who were abroad at the time the restriction measures were taken. They are Cubans who have been arriving in our country from Mexico and other countries. That is why we're talking about confirmed cases of Cubans that have as a source of infection been abroad. They have returned from their stay in some country of the world, and having arrived here, they were already in the incubation period, and the disease was confirmed. The female sex has fewer cases, 48.5% of the 18 confirmed cases. Pardon me. The female sex has more cases with 55.5%. That is, 10 are female. Nonetheless, in the cumulative total, 48.5% is female. Yesterday, 44.4% of the cases were male. But in the epidemic overall figure, the male cases account for 51.4%. 77.7% of the new cases were asymptomatic. This is a very high risk group because the people cannot be detected. These people cannot be detected unless they are surveyed. To date, of all the confirmed cases in the country, 810 have been asymptomatic at the moment they have tested positive, and this accounts for 48% of all confirmed cases as of this date. Of the 18 cases confirmed yesterday, the largest number is between 40 and 59 years of age, with 10 cases, followed by 60 and over with 5 cases. The province in which the highest number of cases were confirmed is Havana, which yesterday had 8 cases confirmed. Of the 1,703 patients diagnosed with the disease in our country, 98.8%, that is 617, have a stable clinical evolution. And some people ask me, what do you mean when you refer to active case? I think yesterday when we talked about the behavior of the curves, we talked about this subject. Active, I was telling the mathematicians, is a person that is confirmed and is admitted to some health unit. Because from the total of confirmed cases, you take out the ones that have already died, unfortunately, the ones that have been evacuated, and the ones that are discharged. Therefore, what is left? Well, those who are admitted at this time. So the active cases until 12 o'clock last night were 631 people. Of these 631 people with a stable clinical evolution, there was a 97.8%, that is 617. We are not reporting any deaths today. You may think that this is a lie, but for me, it's really flattering not to have to report any deaths, because this denotes that lives are being saved. So that adds up to 69 deaths, up to the last one that we had 2 days ago. And that gives a lethality rate of 4.05. We always mention the 2 evacuees since the beginning of the epidemic, and of the 1,703 diagnosed patients in the country, there have been 1,001 discharges. 1,001 people have recovered from the disease, 47 of them yesterday. This represents 58.8% of all cases that have been diagnosed in our country. We always refer to the incidence rates of positive cases by province. I am talking about the rate per 100,000 inhabitants. And in this case, as in previous days, the special municipality of the Isle of Youth remains in first place with a rate of 50.4. Havana follows with 7.9. Villa Clara with 25.2, Ciego de Ávila with 16.7, Matanzas with 17.5, Santa Espiritus with 14.4, Mayabeque with a rate of 12.5, Holguín with 9, Pinal del Rio with 8.6 per 100,000 inhabitants, Artemisa 6, Cienfuegos 5.9, and Camagüey 5.1 per 100,000 inhabitants. The rest of the provinces is below 5. This has been the behavior of the provinces that has been maintained, and the incidence rates indicate the territories where we have had a greater number of confirmed cases, regardless of the fact that we do not always talk about it, if they remain in that standing. We can add that as of yesterday, of the 1,703 confirmed cases, they are in 106 municipalities of our country. And in terms of the lethality, which I said that it was of 4.05%, the lethality as of yesterday in the region of the Americas is of 5.76. And of the 35 countries of the region of the Americas, 10 have a lethality rate above 5.76. I have also been asked about the discharges that have been made by province. I'm going to refer to the clinical discharges. You know that after 14 days of evolution and with the regression of all the symptoms and after a PCR test negative, the person is discharged from the clinic and goes to his home where remains in restriction of movements and of visits, with follow-up by the family doctor for 15 more days. After those 15 days, I'm talking about a month from the start of the symptoms or from the detection as an asymptomatic contact, the PCR test is in real time, is repeated, and if the result is negative, then I am epidemiologically discharged and can go back to work to my normal life. Pinar del Rio province accumulates 31 discharges up to yesterday, Artemisa 28, in Havana 409 people have been discharged, in Mayabeque 18, in Matanzas 52, in Villa Clara 158, in Cienfuegos 11, in Santo Espíritus 54, in Ciego de Ávila 72, in Camagüey 35, in Las Tunas 8, in Holguín 59, in Granma 10, in Santiago de Cuba 35, in Guantanamo 3, and in the special municipality of the Isle of Youth 18, for a cumulative total of 1,001 discharges, which is, as I previously said, account for 58.8% of the 1,703 cases confirmed in our country. Yesterday, 47 people were discharged. I'm recalling the issue of the curve and the peak, which is what the information asks most. Today is the 5th day in which we have more discharges than the number of cases that have been confirmed, which gives a negative balance. So today is the 5th day in which we continue to lower the cases, and as I said, there should be no confidence in relation to the relaxing of behavior, because all of a sudden a new cluster of cases may be reported, like the ones we have had, and our population has been informed about them. Yesterday at the roundtable program, our minister spoke about all the clusters of cases that we have had in the country, a total of 42, of which 11 have been closed, and more are planned to be closed soon. But these are clusters that arise due to the failure of compliance with the protection measures or restrictions that have been proposed, thus leading to an increase of cases. And we know that all Cubans are going to work to prevent that from happening. As of yesterday, we have 4 patients in critical condition and 10 in serious condition. Unfortunately, 1 more critic and 5 more in serious condition. As of May 5th, 184 countries have reported cases of COVID-19, with 3,544,222 confirmed cases, 76,901 in one day, and 3,998 deaths in one day, for a total of 250,977 fatalities, which gives a lethality worldwide of 7.08%. In the region of Americas, there are already 1,513,928 confirmed cases, 37,986 in a single day. This represents 42.72% of the total number of reported cases in the world, with a total of 87,232 deaths, 100,972 on a single day, and a lethality, as I said earlier, of 5.76. Yesterday, I was asked if there are 184 countries with cases of COVID-19 diagnosed, which are the ones that have not reported any cases of COVID-19 or have not detected it or do not have it? Well, there are 14 countries. They are North Korea, the Marshall Islands, the Solomon Islands, Kiribati, Lesotho, Micronesia, Nauru, Palau, Samoa, Tajikistan, Tonga, Turkmenistan, Tuvalu, and Vanuatu. So these are the 14 countries that have not confirmed COVID cases so far. So, and this is the information we had to give you today.